या सो हेलो एवरीवन, मैं सबका वेलकम करना चाहती हूँ हमारे आज के हीलिंग सर्कल सेशन में। मैं सबको आज की गाइडलाइंस बता देती हूँ। हीलिंग सर्कल्स आर सेफ हेवन्स. They are built on a foundation of kindness and respect. Circle participants agree to listen with compassion and curiosity, honor each other's unique ways of healing, and don't presume to advise or fix or try each other. Hold all stories shared in the circle confidential. Trust each of us has the guidance we need within us, and we rely on the power of silence to access it. So, I welcome everyone, and I will give a quick introduction of today's speaker. Today, we have with us Mr. Vinod, who is a lung cancer caregiver. So, I will just give a hello, Mr. Vinod. How are you?
Hey, I'm good, Asta. Thank you so much. Thank you so much. Are you able to hear me?
Thank you. Yeah, we can hear you. So I'll just give a quick introduction of today of Mr. Vinod. So Mr. Vinod shares this message with all other patients and caregivers. As a caregiver, be logical in your decision. You have to be careful while you talk to the patient and the people around them. Do not show a lot of empathy or sympathy or make them feel like a patient. Act normally around them and be kind, but do not fake kindness. Do not show your pain or agony to the patients. If you are emotionally weak, express it elsewhere, but not in front of the patients. Never make them feel alienated. Think of them as a normal person. Let them behave the way they want to. You must not react to it. एंड मैं आप सभी को जल्दी से ZenOnco कैंसर केयर ऐप के बारे में भी बताना चाहूंगी। आप सबको ये ऐप जरूर डाउनलोड करना चाहिए, क्योंकि आपको आगे होने वाले सारे कैंसर हीलिंग जर्नी सेशंस के रिमाइंडर्स वहां मिलेंगे। एंड साथ में आपके जो भी डाउट्स हैं आप वो कैंसर एक्सपर्ट्स और डॉक्टर से पूछ सकते हैं, वो भी फ्री ऑफ कॉस्ट। सो इसी साथ वी कैन प्रोसीड विद टुडेज सेशन। Yeah. So, Mr. Vinod, can you tell us, could you introduce yourself and tell us how it all began? How did the cancer get diagnosed? Okay, just a second. I think we cannot hear you.
Yeah, I think you need to give me the power to unmute actually. Yeah.
Yeah.
Hey, sorry, Asta. How do I set the background of this, the one which you gave? I just got off the office call, so I didn't find time. How do?
Okay. No worries, sir. No worries, sir. I can do it
Okay,
this
okay,
like this only. Yeah.
okay. So, namaste to everyone. My name is Vinod. I'm based out of Chennai. I'll be able to understand Hindi fast, but not speak Hindi fast. So, Asta, if somebody is really wanting to know in the dialect in Hindi, right, I would request you to do some translation here and bit and there, okay? So please feel free
Sure.
to raise your hand and say, I'm not able to understand. I need to have it in Hindi. I'll pass on the baton to Asta to translate it in Hindi and come back to me, okay? Would that be okay?
Yes, sir. Definitely.
Yeah. So mostly my conversations will be hovering around 99% will be only on English. I pardon for that. Please pardon me for that. I can understand Hindi very fast, but not speak Hindi very fast. Okay. So again, formally namaste to everyone. So it all started in 2019. Okay. So my dad had some palpitation and short breath and a little bit of breathlessness. It was so bad that when he takes bath and comes out very fresh, he started breathing. He had a short breath and he was palpitating. Okay, so it all started with two golden hour people who were there during the golden hour, our neighbor and my mother-in-law. So in southern part of India, you have this festival called Varalakshmi Vrida, where it's a festival basically done by the women. So when people visited our house, my neighbor said that at that time my dad was just having the dhoti and he was not put shirt put on. So the neighbor said that his breath is not right. Within about half an hour, my mother-in-law calls me and says that his breath is not right. So two people saying immediately. So I had to immediately next day I said, Appa, come, we'll go to and have a checkup. We went to the hospital and we found that the doctor said, we need to take an X-ray. So we took an X-ray. We came back home. We got the report the next day, but the report came. You know how the X-ray works, right? It's a it's a negative film, black and white. But one half of the lung was completely black and one of the lung was completely white. So we were actually on a very lighter note. We were discussing with dad and mom, what sort of hospital is this? They do not even know have an X-ray machine. Is it the way they take an X-ray? So we were all jokingly discussing like that. We never understood the seriousness of that at that time. So next day we went to the pulmonologist, and my dad was asking, "Sir, do I have lungs? What is this? I don't find the lungs at all." So then the doctor was said, "That's a very good joke actually, but really you don't have a lungs as of now." Then we did not know what to do. So he immediately kind of literally pushed his chair behind, and within he didn't even give us time to even react. He said, "Vinod, where are you working?" "I am working with Cognizant, CTS, a software company." Then he said, "Vinod, I hope you have some insurance. I need to put him in ICU." That was the reaction time that was given to me. I have a younger brother and an elder sister. My mom is there, my wife is there. I didn't inform anyone. They were taking him to ICU. At that time, what happened? The diagnosis was, as per our normal human being, around the lungs, we should have about 0.800 ml to 1 liter of fluid around the lungs. But Appa had 4.5 liters of water around the lungs. So immediately the water was gushed out, and roughly about within about 20-25 minutes, 3.5 liter, 3 liters of water was gushed out, and the lungs was made in a at least in a better shape. So to remove the balance 400 ml, it took take 29 days for them to be extract that water out of the lungs. So then then it was diagnosed that he had some pores in the lungs, and we did a thoracotomy where it was cut from the behind, and the staplers were put in his lungs and closing the whatever the pores were. So the biopsy was sent, and so this is called pleural effusion in the medical world. And the pleural effusion can be caused only for three reasons. Either it can be TB, pneumonia, rather I would put it the other way, pneumonia, TB, and cancer. So we were all praying that Appa should have pneumonia or TB. Unfortunately, it got diagnosed as cancer. So there was a twist in the tail. What happened was the hospital we went, the tissue was taken, and it was sent to Tata Memorial in Bombay. And surprisingly, all the tumor markers which was tested with that for that biopsy, it came as negative. It was the cancer. It said it is not cancer actually. So we were all very happy. In fact, that was my sister's birthday on 5th September 2019. Then in fact, my sister said, "Appa, what more do you want as a birthday gift from the daughter? The cancer has come as negative." We were all happy. And then what happened? I went to the same doctor, pulmonologist, and said, "Sorry, now you give me a clearance. Otherwise, everything is okay." But the doctor was a little bit adamant and said, "Why don't we go for a second opinion?" Then we went for a second opinion in Apollo. Unfortunately, it was diagnosed as cancer. And on 27th September, we took him to another hospital with the fresh report. And October 2nd, so between 27th September and October 1st, we were discussing what needs to be done. So not sure how many of you are aware in this call, but I don't want to go into too much of questions. But for a cancer, there are three types of treatment: either the chemo, radiation, or surgery. So for my dad, he was 75 at that time. Surgery is ruled out because as it is, there is one more surgery, and reaching to that particular place is quite a little bit not a little bit complex, and his age is also not supporting him. So surgery was ruled out. Radiation, his body will not withstand because of his age. So we went for chemo, and at that time we decided that the only thing my sister and my brother, as caregivers, we thought only thing we were thinking was Appa should not feel any pain. So as palliative, as slowly it can be given, we are okay with that. If it is going to take 3 years, 4 years, 5 years, it is okay. Let's not go for an aggressive treatment. Then what happened was doctor agreed, and we started the journey. So the chemo started. First, initially, it was like a 3-week cycle with 6 sittings. Oh, okay, fine. See, 3-week cycle, 6 sittings. The first cycle got over. We thought, as normally by this time we would have all, we started speaking to relatives, friends. Everybody were giving their own world they have seen, how is going to be the chemo side effects and all those things. But honestly, for my dad, after the first chemo, first day, second day, third day, we were observing. Appa was saying, I'm normal, I'm normal. The only thing is I'm feeling little bit tired. That's it. Appa, are you able to eat food? He was able to eat food. Are you able to sleep? I'm able to sleep. Any nausea? No. Any bowel movement issues? No. Everything was fine. So then we went and we couldn't believe it actually. Okay, we seen the worst part of it. Everybody we have heard worst part of it. How is it Appa is like this? So second chemo, we went to the doctor and said, what is this? Then said, you guys ask for palliative. We are taking it very slowly. That's the reason why he will not be given aggressive treatment, and which is a good decision as well from your side. So that's how the whole journey, unfortunate journey started. And 6 chemos, we thought it's all done and dusted, because at that time, even after 6 chemos, which is about 3 weeks cycle, is about 18 weeks, close to about 4, 12, 4 months, 4.5 months, we thought everything is over. But actually, then we came to know that it is not that the game is not over. It is going to continue throughout his life. Every 3 weeks, he has to come with for a sitting. So that's how it all started. So he took about 45 chemos from 2019 to 2022 January. So this is the whole journey, Asta. Anything else which you want me to share?
Yes, sir. I do have some questions, and it is
Please.
very inspiring listening to you. Like, apart from chemotherapy, did he undergo any other medical treatments?
Not really. Touchwood, he was not comorbid for any other thing. He was not having sugar. He was not having BP, cholesterol. His body structure was itself was very thin. So everything was under control. So he had only this cancer as the treatment which was going on.
Okay, okay, right. And like you already told about the medical treatment, so did you all consider going for any alternative or any complementary therapies?
Actually, that's a good question. So what happened was, after the first chemo, between the chemo decision and the first chemo actually sitting, right, we were thinking whether this should be we should go for allopathic. Somebody were saying, take this entire paper, go to Kerala, they have something and all those things. It's just free of cost. Then honestly, this is a place I know all the speakers, or rather all the participants in this call would have, for a moment, life will become blank for some time for both the patient and the caregiver. So we didn't know what to do. We went only for allopathy. And after the first chemo, when things started slowly settling down, and Appa was feeling comfortable, uh, then we thought, okay, Appa, are you okay with this treatment? We asked his opinion, because in my opinion, as a caregiver, you should always keep consulting with the patient, because at the end of the day, he is undergoing everything. So consult with him. So Appa said, no, I'm happy with allopathy. That's how we started. So we did not go for any other alternate methodology.
Okay, okay, understood. So, sir, I had a question that did he undergo any major lifestyle changes like during his treatment and all?
Okay. So thanking the stars, right? I'll come to this, why I'm saying thanking the stars at a later point of time. Thanking my dad generally has a very serene life. Okay, he's a laid back life. He was a professor in college, loved by everyone. He was a packaging technologist. Uh, his life was very simple. He used to teach, come back home, have only homemade food with prepared by mom, and after that he will sit in his recliner or the easy chair, have a book or novel, and just while away the time. That was his normal routine even before this was diagnosed. So per se, was there any, and he was never a social animal. And he had only two passions. One is about packaging. The other one is, his opinion is, all the middle class people have to have education. So whoever talks about any education, anything about college studies or school studies, that was his only subject which he will passionately discuss. So other than these two, is after the chemo, nothing changed. Nothing changed. Again, he goes back to his own recliner or the easy chair. Now, in fact, on a lighter note, he would say, "Hey, doctor has said I should not go anywhere. I'm going to still more relax." That was the point from him. So we didn't have a choice. So as long as we are happy, we are happy.
Okay, so that is nice that he did not undergo so many changes. So, I wanted to ask, as a caregiver, there must be times where, there would be a lot of tension and emotional stress, mental stress. So, how did you manage it at that time?
Yes. So, okay, this is about on me. Okay. So, to the benefit of all the participants in this call, as Asta introduced me, right? So this is my point of view, my personal point of view. I have experienced this. I'm not going to generalize this. I'm just sharing my experience as a caregiver, right? First thing, if you want to cry, cry it aloud separately. Go and cry it out completely. Vent out everything. Okay. Suppose if you have a very close friend or a jaddy buddy kind of some person, vent it out, vent it out, vent it out. Then come back with an emotionally strong. You can, for venting out, you can take 2 hours, 3 hours, 4 hours, no matter. After that, you come to a normalcy sometime within 4 hours. Then slowly it will start sinking in. Okay. And you will start accepting things. Okay, this is what it is. Once you have the, as a caregiver, if the person has got that acceptance, right, then he becomes slowly emotionally strong, not immediately, slowly emotionally strong. Once you get that right, to handle the patient and the people around the patient, a caregiver will be able to handle it with a little bit of ease. Okay. In my case, I did the first part, and sometimes after 2 3 chemos I would want to cry again. So I will go back, I'll cry and come back and again come back. Okay. I never showed it to my dad. And the one point I would definitely want to convey is the patient should see the caregiver as a very confident person. That would boost their motivation, morale, like anything. That is what I saw in my dad. Oh, my son has come. So that is the word he uses. Okay. So he stays about two blocks away from my place. At the moment I enter, he will say, "My son has come." So that is the level of confidence he used to have when he immediately sees me. And a humble request, caregivers, please ensure that you cry alone and be normal with the. You need to have a split personality very, very conspicuously. You need to have that.
Right, sir. I agree with this. We have to be strong. We should be strong in front of the patient, right? Uh, Yeah, so, sir, how did you manage your social life and your professional life as a caregiver at that time?
Okay. So, professional life, I had to compromise. Uh, what I did that 3 years, I went into a neutral gear. Uh, I had a open talk with my manager and said, "Sir, I will be doing the normal work. Don't give me any extra work. I will ensure that the normal work does not get impacted. Whatever I need to do, I will do. After that, I will close my laptop at 6 o'clock." That was an agreement made which had an impact on my career progression. But I am till date, by God, I'm saying I am not even repenting for that, because I feel proud that I have done something for him rather than getting into professional world. Any day I can achieve it. But these days will not come back. So I ensured that I strike a deal with somebody and openly had a chat. This is what I am. I spoke to the human resources department and I said, "This is what I will do. I'll come to the office and I want an exception of working from home." I started working from home in 2019 itself. So that continued because of COVID as well. So that was a blessing in disguise for me. So thanking the stars I used earlier, blessing in disguise me. So I'll tell you why I'm saying all these things later, come sometime later again. So professional life, I had a what to say, a deal with my company. On the personal front, I have a good support system. My wife, my sister, my brother, my in-laws are there, my friends are there. Uh, they understood me. So yeah, I use that's again. So I come back not in front of my dad, but I come back and kind of went out all my emotions and feelings. So per se, for me, personal life did not get affected, Asta.
Okay, sir. So, sir, I had a question. Like, while you were going through the journey as a caregiver, there must be some times when you just felt like it is too much to handle, and you felt like giving up. So, like, what were the things that kept you motivated and that kept you going on?
Yes, very, very valid question. So at the end of the day, I am also a human being. I know it's my dad. I am no person without him. Yes, those times did come. Irritation, frustration, annoying. In fact, if you ask me, I still have that guilt feeling in the last few days. I kind of, I lost my cool for something. Only thing is, he was not having his food properly after 3.5 years. I was just saying, Appa, you can't even have what as a 2-year-old child can have it. That is the word I used. But actually, now if I retrospect and ruminate back, right? Yes, he was a 2-year-old child at that time, which I missed it actually. So even today, because of that word, probably, and after that, he was not with me within a 3 or 4 days. Even today, I have that guilt feeling. Did I do that? But in the previous, when I was able to kind of striking a balance, emotional balance, having a emotional quotient at a high level, right? I was getting irritated, but I will never show my frustration in front of my dad. I will never do that. I go out and call somebody and say, Kya yaar, Appa is doing like this, or why is he doing all this nonsense? This is what I used to say, but never in front of him. That's what I'm saying now. Every minute, the caregiver has to be extremely mindful. Every minute, every second, he has to be mindful of what he is doing. So that is a level of detailing, because we have to understand that at the end of the day, we can do anything, but at the end of the day, they are carrying the burden. So the real pain and the burden. So we have to ensure that we support them.
Right, sir. Very true. So, sir, like I had one more question. Like, what were your top three learnings from your entire journey?
Top three learnings from entire journey. With respect to this particular events itself, right? That's what you're asking, right? This entire 3.5 years, right? That's the question, right?
Yes, sir. Yes, sir. From your journey. Yeah.
Okay, top three learnings is you have to be emotionally strong. You need to rise fast more than the patient. The caregiver has to rise fast more than the patient.
I think, um, Mr. Vinod, we cannot hear you.
Did something happen?
Uh, yeah, actually, I think there was a network issue. Yeah, now it is fine.
Okay. So, and as a caregiver, you should be mindful. And third one is you are the if you're one of the important caregivers, there may be a lot of caregivers. You are the hope for them. That is what is the learning. You are the only hope for them. Okay. Uh, these are the three learnings, in my opinion, Asta.
Right, sir. So, sir, what message would you like to give to cancer patients and cancer caregivers?
Okay. Uh, cancer patients, you are not abnormal, you're all normal. It is just that extra 2-3 cells has grown. That's okay. Nothing to worry. It will go off. God is there. There are good people around you. If now I'm coming back, I'm tying back this question to some of the words I used, thanking the stars, and what other I think I said, thanking the stars, blessing in disguise, right? So I am a strong believer that if God is closing one door, he's definitely going to open many doors, not one door. He's going to open many doors actually. Uh, in my opinion, right? In fact, I'll tell you some of the doors that have been opened by God for me. Okay, this happened to me. Pardon me, I'm not painting any political picture here. Do not think I'm doing any political bhashan here. So on 27th September, when Dad was taken to the hospital, we were discussing. The doctor was very, very kind enough. His name is Professor Subramaniam. He's 81 years old. He's 81 years old. And first he asked about him, about all three of us, and about my mom. Then he asked, are we in good terms? Meaning me, my brother, and my sister are in good terms. Are he if dad is in good terms with the children, he ensured all those things are in place. After that, he started the conversation. After that, what happened was, I'll come straight to the point, is we were talking about the financial aspect. So we were diagnosed with one uh, what's that drug actually. That drug in 2016 was costing 1.4 lakhs per vial. Okay. Appa had to have 800 mg of it in 2019. Can anyone guess, if you are able to unmute or not unmute, can anyone guess what was the cost of that medicine in 2019 when I took my Appa? It is actually 1,000 rupees per mg. So the vial is 8,000 rupees per vial actually. And here we have to thank Modi, who has brought all the life-saving drugs into Life-Saving Drugs Act. 1.4 lakhs per vial was costing from 2016. It was costing 8,000 rupees per vial in 2019. Okay. I'm saying I am no person to do any political this one. This happened to me. So the Dr. Nitya was there. Nitya said, Nitya, what is this? Then she explained this to me. Modi has brought this. Then per sitting, all put together, I was including the nurse charge, room rent, everything per sitting. I used to get about 50,000 to 60,000 per sitting. Okay. Think about 42 chemos with 1.3 lakhs only for the vial. Okay. For 42 sittings. What is the cost there and what is the cost here? So why I'm saying is, this is one thanking the stars. Okay. The point, coming back to Asta's question, is God opens the doors in many, many ways. I started picking up those signals from God. God, yes, you have given me, you should not have given me this to my dad. Okay. But you have given this to him. Now, what are the other aspects you're going to give me? At that time, slowly, one by one, these are the signals I received. Probably I'm a little bit exaggerating, or am I being a bit emotional, or am I a bit dramatic or cinematic, whatever way you can take. But this happened to me. Every moment we were taking the signals of, see, for example, my dad, coming back to ask us one of the question, what was his lifestyle? I did not see any lifestyle change in him. Okay, that is a huge mental agony for cancer patients when there's a huge lifestyle change, right? That did not happen to me. So then I had said, oh, okay, this is a tick mark. Okay, not a tick mark. Obviously, the disease itself was not a tick mark. Now, what are the other? Okay, we know, was everything for you bed of roses or everything was green? No. 2019, 3 sittings we were happy. 2020 March, COVID lockdown, and I had to take him for every 3 weeks. I had to take him, and 2020 lockdown, I had to run to the municipality. I have to go to the corporation. I have to go to the police to get the permission to get out of the road. I had to run around for everything. I was stopped everywhere. This hardship I had to face. So which means this is one God has tested me. Okay, he's testing me. Let me come out of it. The other point, most important point, these are all at least very, very logistical arrangement. This I can anyway, this is my problem. I take it out. But the real problem came when after 3 or 4 sittings, he started losing his blood count and platelet count. And during that time, no donor was ready to give blood because everybody was scared to come out. Everybody was scared to come to the hospital. And our hospital was closed as a COVID center. We had to go somewhere else. The moment doctor writes that particular platelet donor or a blood donor, right? My wife will make 500 calls. My sister will make 500 calls. My brother will make 500 calls. I'll make 500 calls. On a day, we make 2,000 calls together. You won't believe 40 people will respond. 10 people will come to the hospital. 4 people will be eligible for donating. So this was the hardship I faced. So why I'm saying is all this happened. So as a caregiver, right, remove all the hardships. Yes, you are into it, remove it. You are there to face it, you will face it. Be happy with what are the positives in each and every one. As a patient, as a caregiver, look for all the positive things around you. You will be able to identify that. Take that signal and please, in my opinion again, God is sending that signal. That is my humble opinion.
Right, sir, very true. And it was really such a tough time during the lockdown. It was really very tough for the blood donors as well and for the ones who needed it. So it was really a tough time. So, sir, yeah, I had a question. Like, if you have to sum up your entire journey in a single sentence, then what would it be?
See, in a single sentence, first of all, I pray to God, no one should get it. Someday, tomorrow, there's a magic wand in his hand and say that this is not there at all. Okay. That is my first, very primary wish, actually. But practically, if you ask me, what was the question?
So, like, if you have to sum up your journey, then what would you say?
Sum up the journey. Everyone is normal. Don't worry about it. Okay, it has come. Chalo, tu ya me. That should be the attitude. I will face it, whatever happens. That would be this one. Yes, easily said. I am not giving any dramatic, cinematic. Easily said. Very difficult to practice. And caregiver, if the caregiver is close to the patient, you are the only hope for them. You ensure that even sometimes in my example, I understood my dad more than my mom understood my dad, actually. They have been married for 50 years. Okay. Actually, she did not understand my dad for some reasons. And especially this tough time, she could not really, of course, she has come from a village. I'm not expecting from her. She has studied only till 10th standard. She could only do certain things, but she did not really understand the nuances. So at these 3 years, I understood him very well. One other thing I would say, uh, if the caregiver if the caregiver feels the patient is highly educated and knowledgeable, like my dad, and if the patient is very knowledgeable, please do not Google any of the terminologies of cancer. Do not Google any of the medicine names. Do not do that. Okay, that itself will depress you. Okay, be normal. Nothing has changed. Be normal. That is my viewpoint. Easily said, but practice it will come.
Right, so definitely. It was, the entire journey that you told, it was so much inspiring, and I just know that it would help so many of the cancer caregivers out there. And I would like to ask if anybody wants to discuss anything, if anybody has any questions, so they can write on chat or they can raise their hands. Right, so Deepak ji wants to discuss. Deepak ji, yeah, तो मैं आपको unmute कर रही हूँ.
Hello, good evening, Mr. Vinod.
Namaste, sir. Namaste, sir.
Namaste, namaste. I want to ask you which vial you used.
Which?
You know the name of that medicine?
Yeah. The name is gemcitabine. Gemcitabine.
Yeah, that is correct. You told correctly.
Gemcitabine.
Earlier
Yes.
it was very costly, and now it's due to generic version. You're getting it very cheap.
Correct.
Same thing is there. If you go to only 4 years ago, Herceptin was 84,000 for one vial. Now it's you can get in 8,000 rupees.
Correct. So, sir, this is what God is being kind of trying to help us in a different way. Though He did not help in a bigger way, but this is a testing time. That's it.
And you are correct that when one door is closed, another many doors are open.
Many doors. Yes, the proverb goes as one door is closed, one door will open. No, in my opinion, one door is closed, many doors will open.
Yes. I was earlier caregiver to my mother-in-law. Now I'm a caregiver to my wife.
Oh my goodness. I pray God sincerely, sir. To everyone in the call, I pray God very sincerely.
Everyone has to pray for each other.
Yeah. So some of the things I am going to share, sir, with your permission, with Dimple's permission and Astar permission. So I'm starting a trust in his name. I'm the legal things are going on. February it is his first year anniversary. So after that I'm going to register the trust, and me, my sister and my brother. So this is to help whoever is there, whoever is wanting to need. Of course we are going to have a structure, not that we are going to make it very unstructured, very structured. So this is what it is. So if I can share one more good learning, right? In fact, I told Asta, like, I will prepare a PPT and send it across as a workflow. Okay. So what I did was, in the hospital as a caregiver, I thought of some innovative ideas, and that worked for me very well. And the hospital said, we will implement this also to other patients. Okay. So I'll take it just 2-3 minutes to explain this. Okay. So see, the foundation or the primary underlying statement is the patient is undergoing real pain and mental agony. That is the underlying statement. Okay. So as a caregiver, what are the things you could do to ensure that, not avoid or eradicate that, but try to minimize as less as possible? Okay. So for that, what I did was, initial days after the chemo was over, the discharge summary will go, the doctor will do all the corrections, then it will go, and by the time the insurance will come, it will take about 9 o'clock. The chemo would have completed at 6 o'clock. Between 6 in the evening and 9 o'clock, we'll be sitting idle. Dad will become impatient. Hey, I want to go home. All this I was observing for 2-3 sittings, and then said how to reduce his mental pressure. So what I did was, I went to the hospital finance department, and I said, see, again, coming back to Deepak ji, sir, one door closes, other doors open, right? I was working with Cognizant. God has kept me in a kind of a little bit affordable position. So then I went to the finance department and said, hey, his name was Balaji. He was the CFO of that hospital. Hey, Balaji, my name is Vinod. This is my patient ID. This is what it is. I'm going to be with you. This is what is the diagnosis. So now what I'm going to do is, I'm going to deposit 2 lakhs with you as a advance amount. Keep it with you. Okay. I don't have any problems. Anyway, I'm going to come to you for next I do not know how many years. So what I did was, once the doctor gives the prescription, I ensure that first I go and get the room, admit dad, ask him to lie down. He will listen to some mantras or slokas. I'll ensure that he's very, very comfortable. I'll give him his food, whatever it is. Then come to the pharmacy, and I used to have a good connect with them. And they say, hey, the doctor has given the schedule. Can you just keep the basket ready of the medicines, keep it ready, because the administration has to start within 1 hour, so that I can go back home about 9 o'clock. So I used to do everything. It was they say, no, only our nurse should do, but I'll try to make some way or the other. And I used to have good rapport with them, get the medicines as far as possible. The administration will start. Then the discharge summary will come. I will get this 6 o'clock. It was about 9 hours chemo. I'll get discharged by about 7 o'clock. The point why I'm saying is, what I would tell this guy, tell the finance team and the cashier team is, hey, I have deposited 2 lakhs with you. Today the bill is 60,000. So you take 60,000 from the 2 lakhs. If you don't get the insurance by tonight, I am leaving. You are safeguarded. My money is at stake. That is okay. Then what they will do, late at 11 o'clock, they say, Vinod sir, we have received the approval from the insurance department. So then they will refund the balance amount in my account. So that was these are the workarounds to ensure that the patient is comfortable. So after 4th or 5th chemo, we used to leave at 6 o'clock once the chemo is done and all the whatever the normal formalities of went on, everything is removed, right? Before that, we used to leave it only at 10 o'clock or 11 o'clock in the night. So these are some of the things. That's what again I'm saying. You should be extremely mindful of what the patient is undergoing, how you can be proactive and help that patient. That is one of the experience I want to share.
You're correct. The same thing is with us at Lilavati Hospital. We enter at 8 o'clock, 8:30 the procedure starts, and 6 o'clock we come back at home. No, nothing I have to do. The trustee of the hospital do everything, whatever I have deposited the 2 lakhs rupees in the starting.
Exactly.
Same thing I have done.
Correct. So and then,
from the second chemo. That
correct.
was from the second chemo.
Second
First chemo, I meet the trust in everywhere. And I do all the thing.
Correct. Right.
You're correct. And we'll do this with the many hospitals. We will try in the next.
So this hospital came back to me and said that, sir, your arrangement is very good. Whoever is able to afford it, we will try to implement this. That's what they said. I mean, again, it all depends on the affordability. Not everybody will be able to deposit 2 lakhs.
Correct.
But yeah, this was it. So that is what it is. I mean, this is what I wanted to share as one of the experience. I'll make a.
We'll be in contact later on also.
Sure, sir.
So we can discuss more about this.
Sure, sir.
Yeah. Asta, thank you.
Thank you so much, Deepak ji. Thank you so much, both of you, for discussing and sharing so much knowledge with others. Vinod ji, we have some questions for you. So, Disha ji wants to ask how to take logical decisions during tough times. So, like, what would you advise?
Okay. That's a very, very apt question, interesting question, logical question, tough question also. Okay. So how to take logical steps during tough times? That was the question, right?
Logical decisions during tough times.
Good. Okay. So it depends on the caregiver's individual capacity. That's I'll tell you, but it's not tough. It is easy to practice. My simple secret sauce is close your eyes, take 2 minutes. Do not react at all. Do not react for anything. Okay. Go back, have your personal time, take 3 or 5 minutes. What am I supposed to do? Logically, what am I supposed to do? This is what it is, okay? The moment you think through that, right? See what is the problem in hand, only concentrate on that. Take 5 minutes, and this is my experience. Think only 2 steps ahead. Do not over-engineer. If you start over-engineering, you will get confused. 2 steps at a time or maximum 3 steps at a time. What are the logical steps I need to take? The moment you take the first step, then you need to look for the next 3 steps, which is 1, 2, 3, 4. When you're taking the second step, look for 2, 3, 4, 5. That is how we have to do. I'll tell you, what is it that you're explaining something very abstract I'm not able to hear, right? I'll give you a small example, okay? Very first time what they did was, I think in March 2020, we went to the chemo. That time I'm in Tamil Nadu. So Tamil Nadu government had said that you need to do a COVID test before chemo. Okay, that was the very first time. Okay, nobody knew what this COVID test was. That what do you call that? The swab test and all. Nobody knew at that time. So what happened was then we were asked to go back. And the 3rd or 4th chemo, we were asked to go back, means we have not done the test. What will happen? Immediately you start imagining, right? Appa started getting jittery. Ayo, what, we have to go back, no chemo. I said, Appa, hold on, you sit down, let me come. I went back and I asked him what exactly the issue. Then he said, sir, you need to buy a PPE kit for 5,000 rupees, which is to be worn by the patient. Okay, fine, give me 5,000 rupees. That's okay, give me. Then they said, no, sir, you cannot do it here. You need to go back to your district because we were in a different location. Now, all these are government confusions. I said, what? Hey, we have come to the chemo and what are you doing? Then I thought, okay, fine. Something is not right. What is going on? I said, I spoke to the relationship manager. Hey, her name is Soumya. Soumya, what is exactly happening? No, sir, the government order came only this morning. We cannot give chemos to any patient because everybody has to go on swab test. It will take 24 hours for them to this one. I said, see, this was not never told. Then they said, no, even we got the government order GO only this morning. Then what I did not do anything. Okay, the problem in that is Appa has to have a swab test. Okay, and the chemo has to start. I started serious. This is what I did. I did not tell my Appa whereabouts. I asked him to sit in the lobby. I went to the parking lot. I was thinking what needs to be done. Suddenly, once again, this is what somebody asked this question, right? Logical thinking. What can I do? I had a medical pharmacy friend. Okay, his name is Yogendran. Then I called him and said, Yogendran, this is what is the situation. So since he's in a medical field, sir, there is a lab called High Tech Labs. I know one person. You call him and you see what needs to be done. So that was at 12 o'clock in the afternoon. Then his name was Syed. Then I said, Syed, sir, this is what it is, this is what it is. Sir, I'm on rounds. I'm taking swab test across all the home collection. And sir, my last collection point is at 2 o'clock. I know you're far away. Can you drive down far, come immediately? And so that I can come to your home at 1:30 and pick up the swab test. So then I went to Soumya and said, Soumya, I'm leaving now. Okay, I'm leaving now right away. No, sir, the payment and all I will do later. I have something very important. I'll come and inform you over the call, karke. Immediately I left. 2 o'clock, 2:15, the swab test was taken. Okay. To answer ma'am's question as to what did you do, right? Believe till 12 o'clock afternoon, I did not know what I need to do. Nobody were giving me a clear picture. They were asking me to run pillar to post. Go to this district, you need to go to that district, you have to buy a PPE kit for the patient. I need to wear something, they were saying. Okay, now it all looks very, very simple, but I'm talking about 2020. So the logical thinking is what I need to do, what is the problem in hand, what I need to do, what are the options available. Okay. Probably for me, the first time I spoke to that yogi and then probably it worked out. Probably had it not worked out, I would have had another 2 or 3 options. This is one of the logical, you need to be extremely vigilant at that time, not to lose your emotion. Yes, it is a tough time, but if you practice, it will come. It will come. So close your eyes, think for only 2-3 steps ahead. What is the thing I need to do? What steps I have to take?
Right. Thank you so much, sir. We have just 2 more important questions. So they're asking how to not cry in front of the patient.
Cry as much as possible in alone. That is the easiest one. Even if you want to cry, you will not cry. You will not be able to cry. Cry as much as possible alone. Okay. Cry and your tear glands will dry off. I'm telling you, your tear glands will dry off. That much level of crying you have to do. And the moment you cry out, it will automatically, your emotions will start slowing down. You come to your near and dear one, nothing will happen. But you have to cry a lot alone. If you have a good friend or somebody, cry alone a lot. It will take 2 hours, 3 hours, 4 hours, that is okay.
Right, sir. So we have one last question. Why can't we share our weak side with the patients?
Never. That's what I say. No, see, it is like a tendril in a creeper, right? The creeper is holding on to the tendril to grow, right? If you start weaker, no, it's actually see, bluntly put to all the people, right? I was never believing. My wife used to believe vibrations, negative, kya bakwas hai, negative vibration, positive vibration. This was the exact verbatim words from me to her. Okay, what vibrations? Okay, but now I felt the moment you say weak side, right? it will actually start affecting them. They will also think, that's what I said, no, bluntly put, till January, December tak, I was his only hope. That one word where I showed my weakness, I felt irritated, right? I'm still feeling guilty. It happened coincidentally, but I'm taking it. That is the reason why you should never show weakness. The moment you show your weakness, it automatically gets passed to them. I'll tell you some of the tips, okay? The moment you show your weakness, the patient will not see eye to eye and talk to you. They will see the ground or see the ceiling. They will not see eye to eye to you, speaking to you, because they feel that, oh, I have done something to this person. So that is the reason why you should never show weakness to in front of the patient.
Right, sir. In fact, it's like they may feel that they are a burden on us. You know,
I didn't want to
why
use
we
that word. I didn't want to use that word. I did
should-
not use that word. That is exactly what I was meaning in this one. That is what
Yeah.
exactly my dad felt in the Jan 2022. That exactly the word didn't want to use. That's what the signal for the caregiver is. The moment you show your weakness and your emotions goes to them, right? The boomerang effect is they will not speak eye to eye like the way they used to do it earlier. My dad, that's what I said. Hey, my son has come. We will do that. Hey, Vinod ke liye pani puri banao yaar. Vinod ke liye bel puri banao. This is what used to have a conversation. The day he started his food habits, food intake was going down. Right? I used to say, pa, have it, pa. No, he will not speak. He will say I'm not able to eat. He will bow down and say I'm not able to eat. He will not see me. So never do that.
Right, sir. Very true. So, I would again like to thank you for sharing so much of knowledge with everyone. Okay, so Meenakshi ji also wants to discuss.
Please.
Yeah. Meenakshi ji,
1 minute, unmute.
Yeah. Vinodji, thank you so much. I'm a caregiver for my husband. The journey is on. And yes, as a caregiver on this journey, I would say be positive. And आया है तो जाएगा. हाँ, ये तो इसी तरह ही हमको चलना पड़ेगा.
Correct.
There is no other way.
Correct.
And ये तो कोई आगे है कोई पीछे है सब जर्नी में सभी लगे हैं कोई 10 साल बाद में we all come with a return ticket इसको मान के चलिए.
Correct.
So ये हमारा वो है and that is our strength and positivity vibrations all this really helps.
Correct.
And बहुत अच्छे से जो आपको टाइम मिला है. I'm at the hospital now at the MDR Cancer Hospital. My husband is hospitalized. ठीक है, it's okay. It's part of the journey.
Correct.
But लेके चले लेकिन आज बता रहे हैं on now on this journey इसी को ही फॉलो करना है हमें. बिल्कुल विनोद जी आप लोग से जब सुनते हैं तो बहुत अच्छा लगता है कि हम सही रास्ते पे हैं बस यही लगता है. तो लास्ट में जब सब सुन लेते हैं तो मीनाक्षी is on something to tell. Thank you so much.
My pleasure. Actually, Deepak ji, I think Disha ma'am is raising her hand, but before that, Deepak ji, I told you, right, one door opening, I keep harping on that, right? One important thing which I forgot to tell was that 3.5 years, no, with 3 years rather, I told Asta also, that was like a Bhagavad Gita conversation between Krishna and Arjuna, between me and my dad. Every 3 weeks, I used to go there in the hospital. I take holiday on that day. 8 o'clock, I'll be sitting with him. He'll be chemo. Then we used to talk about that. We talk about this. He met Abdul Kalam and all those things. No, it was just like a private conversation between Lord Krishna and Arjuna. Okay, I used to learn a lot of things about him. Okay, that is one thing which today I know about my dad so much more than anybody else. So that is again another door opening. So he is my dad and he has done so much thing in his life. So that is what is another thing which I would really kind of, all these are all positive. So don't think that, oh, he is trying to dramatize. No, that's not the point at all. I'm trying to take all the positives. Okay. That will be a really cherish every moment. That would be the one.
Very good.
You won't believe, can I talk a word?
Please.
Yeah, I won't believe in this journey. My Sevadhari had come with us from Lucknow to Kerala. He was with us since 45 years. He's been working with us. And वो बिल्कुल मेरे husband की सेवा कर रहे थे. After 5 months, he got a throat pain, and when I showed him to the doctor, he said, "Aapko aage chalna padega, go to MBR hospital." And imagine another person in this journey, उसको कैंसर हो गया, he got cured, मैं क्योर किया उनको,
very good,
वापस भेजा है. You have to be, दो तो जन घर में, एक को देखना है, दूसरे को फिर वही जर्नी में लेके चलना, it was not easy. लेकिन that strength, and this is a time when you can feel God with you every minute. Is that, like you said, see the positive side. It is positivity God is sending. एक बंद तो 10 खोल देते हैं दरवाजे. You know, एक मिनट के लिए जब मेरे को मालूम पड़ा मेरा सेवन हरी को भी हो गया है, कैसे मैं करूंगी, दो जन in one house. It was not easy for a minute, but then the journey started because I had already got it, given me the practice. कि इसके पास जाना, उसके पास जाना, इसके पास जाना. His journey went so beautifully. He is like a Hanuman to our story. So I said, now we have to become Ram and Sita. जो 40 साल हमको जिसने look after किया है. He did his job like a Hanuman. अब हमें राम और सीता बनना है. So here कलयुग में तो सीता को ही देखना पड़ेगा सब कुछ. So this is, this is where you see, you can't imagine what all happens in this journey.
correct.
You see the beauty of it. आपको बहुत कुछ देखने को मिल रहा है.
Absolutely.
Thank you so much.
Thank you
so much, Meenakshi ji, and I wish him good health.
Yeah.
And Disha ji also wants to discuss something. Disha ji, I'm unmuting you.
Hi, thank you, Asta ji. Thank you, Vinod ji. Very inspiring session. Just wanted to share on how to share weak points or not cry with patients. I've been a caregiver, and what I felt, my husband was way too young when he was diagnosed. So, sure, every caregiver has a different journey. And you have your own journey as a caregiver. In my case, when we shared our love for each other, and anyway, he would get to know that I cried today, looking at my face, my eyes, and what I realized that it would hurt him more if I don't share, and
Right.
it would hurt him more that she cried today or his mom cried today alone, thinking about that he might go, or what is the condition of my husband today. And when I changed that, when I started expressing with him, we both will cry together and we both will feel that mutual love and mutual fear. He also has his fear, I have my
Yeah.
own fear of losing him, and that actually helped us in walking on this path together, going through this together, when we were sharing with each other what he's feeling, what I am feeling, and we felt that we love each other and we want him to survive. So that actually strengthened our love, and he's healing more. So he would get more motivated that no, I have to do this for her, I have to do this for my family. So at times, maybe sharing with patients and everything that you're going through as a caregiver, we also go through a lot, right? And we share with our friends and family, but when we actually share with patients, it helps us a lot. And I saw a very different person who was very motivated that we all are going through this together and we will get through it. So that mutual sharing, mutual bonding, and working towards a common goal helps us a lot. So maybe not all for all the caregivers not sharing, maybe that might not work, but in my case definitely it worked. That when I shared with him, journey was easy for us. That yes, we would hold hands, we would go for a walk, we will sit in a park, we will cry, and we will like, let's do it together. So just wanted to share my experience as a caregiver.
Absolutely,
where-
ma'am. Absolutely, ma'am. We respect that. We respect that. And you rightly said, no two fingers are the same. As you rightly said, if your path is working that way, that is the best path. Okay. This is, as I said earlier, that this has happened to me. Not everything will fit in the same. All size fits the same. No. If it is your journey is really this one, I wish you both come out of it really well. If that works for you, please go ahead. Okay.
Thank you. Thank you.
As you rightly said, I am not going to compare myself with you. You should not compare yourself with me. It's applicable for everyone. Okay. So please, I wish a speedy recovery.
Thank you, Vinod ji. And Asta ji, I wanted to understand, because I get in touch with many caregivers and many patients who are going through similar journey where they don't know how to walk or how to navigate through this entire cancer experience. And I see ZenOnco is doing some amazing work in this. So can you please tell me, those who are going through tough times or mental stress, emotional fear, and losing patient, it happens all the time once you hear the word cancer. So how
Right.
you or your organization can help with that?
Yeah, definitely, Disha ji. Please do one thing. Please share your number on the personal chat. I will connect with you. See, we have many emotional counselors with us. We have many people. We have cancer support groups. So, from there, they can get a lot of support. They can get a lot of hope. Okay, so definitely you just share your number with me over the personal chat, and after this session, na, I'll connect with you personally, and we'll work it out. Yeah. So please share your number.
Definitely.
Thank you.
Thank you.
Yeah. Shanti ji also wants to discuss something.
Good evening, all. Hello.
Namaste, ma'am. Able to hear you.
Namaste, sir. Mine is a very different story, actually. I'm a caregiver for my son. I'm just sharing my experience. I'm still
Please,
there in the
please, ma'am.
hospital.
Please, ma'am. Please. Write out, no problem.
Shanti ji, are you fine?
No, sir, thank you. I'm there in the hospital even now. My son, he's 17 years old now. He was being diagnosed at 14 years. He's ALL, acute leukemia. And the doctor himself is like, worried about him because we have given head to toe all the treatment for him. Even we have done the bone marrow transplant for him, but it didn't work for him. And he's into too much of trouble and pain. He's the only son for me. And me and my husband are still unable to come out of it. The pain he goes through, and this is the age where they go out and spend their days with their friends and enjoy the days. But he's been house arrest for the last 3 years. Like mentally, physically, and even financially, we have gone through a lot. It's lot, and we have left out with no option now. So this is my story with my son.
We sincerely pray, ma'am. Nothing will happen. Don't worry. We are all together. We'll pray.
No, I'm trying to be strong, but no.
No, ma'am. I understand that. We understand that completely. It's not easy. I have a son who is studying in second year college, and he's also 19 years old. I understand that completely, ma'am, what you're undergoing.
Shanti ji,
Yeah,
could you just do one thing? Can you share your number on the personal chat? We will help you. Like after this session, I will connect with you, and we will help you through this. Okay, you are not alone. Okay, we are with you. Okay, and please just share your number once.
sure, ma'am.
Ma'am, there will be a group praying for you, ma'am. Don't worry. God is there. He will do something. Something he will do. I'm sure. I'm confident about that, ma'am. Some miracle is
And the
going to
worst
do.
part is he doesn't know that it's been relapsed for him for 3 times. So we are just managing him, saying that, like, it's because the counts are going down, you're falling sick, you're feeling low. So he still doesn't know that we have been hiding all his summaries, hospital summaries with him. He doesn't know that it's been relapsed. He has thought bone marrow transplant has cured him. Now he's fine and fit and fine.
Shanti ji, this is Dimple here, and sorry to hear this, but I would say one thing to you: do not lose hope, because we have seen last stage patients who are near on deathbed also coming out of it. So if they can, your son can also definitely. He's too young to go through it. He's a 17-year-old, right? A lot of things can be done. Body has immense self-healing capacity, and I have seen many patients coming out of it. So if they can, then your son can also too. I would personally like to help you with this, guide you on this. We can connect after the session on the call. You can share your number and I will call you after the session. There are mind-body medicine, there is emotional wellness, and I'm not talking about just talking and sharing things in emotional wellness. It's also a lot of therapies that goes in that. A lot of complementary treatment, integrative medicines that has helped people in recovery. So it's not one thing that's going to cure him or heal him. There are multiple things that we can do. So let us make a program for your son, and diet helps a lot in this, especially. So changing lifestyle, changing diet, nutraceutical supplements, integrative medicine. Yes, medical treatment helps up to some certain extent, but that may not be the complete 100% cure always in cancer. So what it is for your son, we have to understand first and then design a program. So let's do it together. You are going through a lot. I can definitely see it, and losing only son, it's very difficult. We have seen many families, many parents, many patients going through it. So definitely we'll help you with everything together, and that's what the purpose and mission of ZenOnco, right? So let's make a wellness anti-cancer lifestyle program that's going to help your son. And but I would say one thing: miracles happens. What all things we need to do so that we also get that miracle, we also get that healing and curing, that we need to work out together. So I'll help you with that. Okay?
Thank you. His
No problem.
platelets are very low. He's only under 3,000 his platelets.
Yeah, I understand. नहीं, हम आपको बिल्कुल help करेंगे. आप अपना number share कर दीजिए, and I'll call you after the session. Yeah, please take care. Yeah,
thank you, ma'am. Thank you all.
Yeah, Shanti ji, please take care. And मैंने I have checked the number on the chat, and also share your number on the personal chat if possible. And Dimple ma'am आपसे session के बाद connect करेगी.
Okay.
Yeah. And number मैं आप सबके लिए no problem. मैं आप सबके लिए number बोल भी देती हूँ. It's 9930709000. Asta, would you like to repeat it?
Ma'am, can you please repeat?
Yeah. Asta, would you repeat, please?
Yeah, definitely. It is 9930 709
Ma'am, 70
709 I'll repeat it again. 9930 709
Yeah, ma'am, I noted down.
Okay. Yeah. So so after the session, we'll connect with you. Okay. And please just don't lose hope. Okay. And we are there for you. Please take care.
Thank you so much. Thank you, ma'am.
Yeah.
Thank you, Vinod sir, and thank you, everyone.
So आपको थैंक करना चाहूंगी आज के सेशन में आने के लिए, एंड थैंक यू सो मच विनोद जी. आज के सेशन में इतनी ज्यादा नॉलेज आपने शेयर करी है, इतना इंस्पायर करा है लोगों को, इतना पूरा डिस्कशन हुआ, इतनी चीजें सीखने को मिली हैं. सो थैंक यू सो मच फॉर दैट. एंड मैं सबको बताना चाहूंगी कि मैंने हमारा नंबर एंड ऐप डाउनलोड लिंक चैट पे मेंशन करा है. आप लोगों के जो भी डाउट्स हैं, आपको कुछ डिस्कस करना है तो आप उस पर पूछ सकते हैं, एंड आपको से आंसर मिलेगा, वो भी फ्री ऑफ कॉस्ट. अपार्ट फ्रॉम दिस आपको आगे के सारे सेशन के रिमाइंडर्स एंड अपडेट्स भी उस पे मिलेंगे. सो थैंक यू सो मच एवरीवन, एंड टेक केयर ऑफ योरसेल्फ.
Yeah, on a closing note, I have not done anything. It's Dimple and ZenOnco Asta who have done this stage, a platform. It is an amazing initiative, Dimple ma'am. we can't thank more than we keep thanking. That's the only word we can do. We have to thank you a lot for setting this stage, ma'am, giving us this stage and platform.
Thank you so much, sir.
Thanks,
Okay,
Zen. Thanks,
then,
everyone.
Thank you, everyone. Take
Thanks,
care.
Zen. Good day. Good. Nice evening. Bye. Bye.
Thank you. Thank you, everyone.
Thanks, Zen. Bye.